The problem of contaminated blood cultures has been a long-standing problem in healthcare, and laboratories have been tracking this for years and years. If you have a blood culture specimen that is contaminated, this could cause diagnostic errors. Like with many false positive tests, you can have adverse clinical outcomes, including extended length of stay for the hospitalized patient. If you have a positive blood culture, your physician will order antibiotics, usually quite strong ones, because this is such a serious condition to have a blood infection. You don't want to get unnecessary antibiotics, so if they gave you an antibiotic that you didn't need because you don't have a blood infection, there's a lot more chance of antibiotic resistant in various bacteria strains. There's been a good number of studies regarding contaminated false positive blood cultures that these cost in the range of $1,500 to $8,000 per event. So when we did our analysis, we took a moderate estimate of about $3,500 per event. The national standard or benchmark for contaminated blood culture rate is 3%. We were always hovering around that 3% threshold, and we thought we could do better. In the past, we had no good way of knowing who collected that specimen after it had been done. We would have initials on the tube or the container, and we never were able to track it after that. If you're just getting initials JT, there's could be dozens of JTs in the hospital, so it was not an effective way to capture that collector information. We had the opportunity to leverage some new technology for laboratory specimen labeling based on barcode technology. We not only captured the patient's identification, but we captured the collector's ID. So whoever collected that blood or other laboratory specimen, we knew exactly who it was. I call this the Holy Grail. I reached out to our laboratory leadership, and I said, I think we can use this. And I did a pilot report to see that we could get this actionable data. The development of the report was key, so that we were able to take all of the collectors and identify them by 3 colors. Red is above the national benchmark. If it's yellow, they're approaching the national benchmark, and if it's green, then they are well within the expectations. We were relieved that most of our collectors were doing a very, very good job, and it was just a subset of the collectors that we had that were, causing most of the blood culture contamination events. We went out and re-educated everyone that was a greater than 2% collector-based contamination rate. In 2014, we were like 2.7% as a facility. In 2017, we were down to 0.9%. When we're collecting about 2,000 of these specimens per month, this is a big change. That's why we were able to avoid so many unnecessary contaminated blood cultures, as well as enjoy the relief of the financial burden of $2.2 million. Reporting what your actual contamination rate was is a game changer. It really puts the whole thing in perspective.